Penile Implant Surgery. Your questions and answers. Brought to you by FixED, www.fixed.net.au.
If a man and his partner decide that a penile implant is the right answer for them, then they need to seek out a urologist who has experience in the area and is regularly implanting penile prostheses. Once they've found that person, then they need to discuss the operation, and I must say, in most men who come along to see me, I see them as suitable candidates, and we go ahead with the operation. The operation involves usually a two-day trip to hospital, overnight stay. It's all done through a small, less than 2-inch incision just above the penis, and the components of the prosthesis are fed in under the skin. We leave a catheter in the man's bladder overnight. That's removed the next morning, and once the patient's up and around and feeling comfortable, then they head out the door. Now, I warn every man who's having a penile implant put in that really the thing that there's only really one, I think, danger with the procedure is that if you happen to get infection when the prosthesis goes in around the prosthesis, then that's a major problem and the whole prosthesis needs to be taken out and another attempt made perhaps 6 months later. Now, the risk of infection is very small though. These days implants are made in a way that antibiotics can be infused into the surface of the implant, and then antibiotics are also given at the time of implantation. With this combination, the risk of infection is really less than 1%. But it's always in the doctor's mind, and we're careful about it. We make sure we avoid it as much as possible. Then once the patient's got out of hospital, I warn the patients always that they will have a pretty sore penis and scrotum for about 2 or 3 weeks, and I explain to them that they will need, very likely, to take medication through that time to keep the soreness under control, and I want them to have a quietish in a physical sense 2 or 3 weeks. And then after 6 weeks, I like to see the patient, and with my practice nurse and myself, we teach them how to inflate and deflate the machine. They need a few lessons in how to activate the pump and to then hit the release button. And then once they have taken all that on board, really 6 to 8 weeks after the procedure, they should be then back to their normal sex life once more, and for them to be in control of the situation with, I think, what could be seen as a cure of the problem.
Penile Implant Surgery. Your questions and answers. Brought to you by FixED, www.fixed.net.au.